Sacituzumab govitecan is a TROP2-directed antibody drug conjugate that's already approved for pretreated metastatic triple-negative disease. It's previously showed improvements both in progression-free and overall survival. But there's been a lot of interest in trying to combine antibody-drug conjugates with checkpoint inhibition, where we have very robust preclinical and clinical data suggesting that these two agents could work synergistically together. And so ASCENT-04 really tried to explore what the efficacy is of sacituzumab govitecan plus pembrolizumab in patients with PD-L1 positive metastatic triple-negative breast cancer that have not had any prior therapy. So patients were randomized in a 1-to-1 fashion to receive sacituzumab plus pembrolizumab or to receive chemotherapy of physician's choice plus pembrolizumab. And the study demonstrated that sacituzumab plus pembrolizumab led to a significant improvement in progression-free survival with a PFS of 11.2 months compared to 7.8 months. So an absolute difference of 3.4 months between the two arms with a hazard ratio of 0.65. So I think really nice to see these improvements for our triple-negative breast cancer patients. So what we saw with the study was that the toxicities that we commonly know are toxicities for sacituzumab and for pembrolizumab were seen. So with sacituzumab, some side effects that can occur include things like neutropenia, nausea, and diarrhea. And there were no additive toxicities that were seen. So the rates of toxicities were very consistent with the individual toxicity profiles of each agent. Yes, I think we're hoping that these data from ASCENT-04 will lead to an approval for sacituzumab plus pembrolizumab for first-line metastatic triple-negative disease that's PD-L1 positive. There is what I think of as a sister study, ASCENT-04, which looked at sacituzumab alone compared to chemotherapy for first-line treatment of PD-L1 negative or patients that were not eligible to get immunotherapy. So that study, we've already seen a press release, in fact, that suggests that it is positive, that sacituzumab did do better than chemotherapy. So we're looking to see those data, hopefully in an upcoming meeting. And then sacituzumab is also getting studied in the early disease setting. So in patients who have residual disease after receiving preoperative therapy, there's a trial called OPTIMIZE-RD or ASCENT-05, which is taking those patients and randomizing them to get sacituzumab plus pembrolizumab, so the same regimen that was used in ASCENT-04, and comparing that in essence to capecitabine plus pembrolizumab, and that study is currently enrolling.